So now we will discuss about HIV testing and issues involved. So it is essential that we learn about the ways and means of finding out whether one is infected or not. Physicians across the world use certain established and approved ways of testing people to find out details about various diseases. Similarly, for HIV/AIDS too, there are certain tests which will help to identify the HIV status of a person. So, the only way to confirm whether one has HIV infection is to do an HIV test. Mere symptoms of the disease in a person alone are not enough to conclude that one is an AIDS patient. People who have exposed themselves to high risk behavior or such situations may go for an HIV test. However, such person may have to seek the opinion of counselor, social worker, psychologist, physician, or a family doctor. There are various ways one can get infected. Similarly, all the body fluids also contain HIV virus. However, the test that is used to diagnose HIV infection detects the antibodies to the virus. Blood is usually used for HIV testing. It is mandatory for a hospital to seek the consent of a person for testing his or her blood for HIV. At the same time, maintaining strict confidentiality regarding test result is very important because of the stigma and taboo attached to HIV/AIDS. HIV virus and HIV tests. Viruses are the smallest living being known to man. Living matter consists of two nucleic acids known as DNA, deoxyribonucleic acid, or RNA, ribonucleic acids. Viruses are an exception. They contain only a single nucleic acid. Human immunodeficiency virus, HIV, is an RNA virus. A protective coat covers the nucleic acid. It is made up of chemical substances that are called as glycoprotein or polyprotein. This cover is called as the envelope or Eve. In the case of HIV, the envelope consists of glycoprotein. The HIV also contains an enzyme known as a reverse transcriptase. Reverse transcriptase synthesizes DNA from RNA. The gene that control these functions are known as GAG, pol, and Eve genes. If you recall, you will remember that protein synthesis takes place in the cell. DNA present in the nucleus of the cell activates RNA. RNA assembles the amino acid to form proteins. Reverse transcriptase enzyme that is present in the HIV produces DNA from RNA. It goes one step backward in protein synthesis, that is DNA from RNA. Hence, it is called as a retrovirus. Now, what is the reaction of the virus in the body? When a microorganism enters the body recognizes the protein present in the microorganism as a foreign protein. This foreign protein is known as the antigen. To neutralize the protein, the body produces chemical substances. These substances are known as antibodies. Antibodies interact with the antigens to form complexes and they neutralize the antigens. The body takes about 4 to 6 weeks to form the antibodies against infecting microorganism. The same process takes place when a person becomes infected with HIV virus. Now, detection of HIV infection. It is very difficult to grow or to make a culture the virus under laboratory conditions. In the laboratory, the virus is grown in a suitable growth media. This process is called a viral culture. It takes about 6 weeks for the culture to become positive and it is costly. Hence, HIV virus is not cultured. A simple and effective test is necessary to detect the presence of HIV in the body. We use the presence of antibodies against the HIV virus to detect its existence. What is window period? Once the virus enters the body, it starts to multiply. During this process, the test does not detect the virus. The patient is highly infectious. After 6 to 8 weeks, the body produces antibodies. The test becomes positive. This period, when the patient has the infection and the test is negative, is called as the window period. Similar situation may occur in a terminally ill patient when his body cannot produce antibodies. The test will be negative while the patient will have the infection. The test turns out negative because it takes 6 weeks for the antibodies to form. In the terminal stages, the immune system may be destroyed so that there are no antibodies produced by the body. Now, what are the types of tests to detect antibodies? To test for the antibodies, 2 different types of tests are used. They are ELISA, enzyme-linked immunosorbent assay test, and Western blot test. ELISA test. ELISA is easy to perform and is cost effective. It is also reliable and sensitive. The basic principle of the test is to detect the antibodies against HIV virus that are present in the blood of an infected person. Method: microplates with the viral antigens are used. Serum from the patient's blood is added to the viral antigens. If the serum contains antibodies against the virus, an antigen-antibody complex will occur. An antibody to the antigen-antibody complex and a chemical are added to test. Depending on the color change, the reaction is reported as positive or negative. Types of ELISA. Different types of ELISA are in use. They are based on the ways in which viral antigens are obtained. Viral antigens can be obtained by 3 different methods, namely whole viral lysate, recombination DNA, and by synthetic polypeptide. At present, only synthetic polypeptide is available in the market. Second, Western blot test. This test is also based on the same principle. Viral antigens are layered on to a nitrocellulose paper. Patient's serum is placed at one end of the strip. The paper is charged with electricity for 24 hours. Antibodies move along the paper and interact with the antigens. Depending upon the molecular size, the antigen-antibody complex move to different areas. These patterns are compared with the standard pattern produced by the HIV to declare the test as positive. Antigen-antibody reaction should occur at all the 3 regions, that is gag, pole and eve. If there is reaction only in 1 or 2 regions, then the test is considered to have shown an indeterminate result. The test has to be repeated after 6 weeks. Sensitivity and specificity. What do sensitivity and specificity mean? Any test that is done to detect a disease does not always correctly detect the disease at all times. Similarly, it does not always rule out the disease. This is an inherent property of the test. Sometimes the test may be positive even when the person does not have the disease. This is known as false positive test. Similarly, the test can be negative even when the patient does have the disease. This is known as a false negative report. Sensitive test. A sensitive test will detect all the cases that have a remote possibility of having the disease. It will detect all false positives. To use a test for screening for a disease, it should be very sensitive. A sensitive test showing a negative result confirms the non-existence of the disease, whereas a positive test result will not confirm the diagnosis. Specific test. A specific test will detect all the cases that do not have the disease. It will detect a high number of false negative tests. If a test has a high specificity, then the presence of the disease is confirmed. The tests that are used to detect HIV should have a high sensitivity and high specificity. An ELISA test has a sensitivity of 90% and a specificity of 99%. A false positive ELISA may be due to liver disease and recent influenza vaccination. We have to be careful while interpreting a test to detect HIV. Now, the very important part in HIV testing is pre-test and post-test counseling. What is the need for counseling? Conveying a positive HIV result to an affected person is a very serious matter. As you are already aware, a positive test result is like passing a death sentence on that person. It is also like passing a moral judgment on that person. As the commonest mode of acquiring this infection is through the sexual route, morality of the affected person is very often judged. There is stigma attached to this disease in the society. Hence, the test result may upset the patient. A patient may have varied reaction to positive test results. He may be shocked, he or she may not believe the report, that is denial, or he may become anxious about his future, become scared, depressed, or angry. Sometimes these reactions can have bad consequences, so that he or she may decide to end his life or become careless and spread the disease to other persons. A patient will have different coping mechanism to counter the shock. She may like his or her family and friends to know about the disease, or he or she may like to hide the fact. Before the test is conducted, the mindset of the patient has to be tuned such that he or she is able to cope up with the test result. HIV disease can also be termed as a disease of behavior. A person's behavior puts him/her at a risk to get infected. If the disease has to be controlled, then a person's behavior needs to be changed. To achieve all these objectives, a person has to be counseled. Pre-test counseling. Among all the types of counseling, pre-test counseling is the most important. It helps to establish a rapport between the patient and counselor. It also helps the counselor to go with the patient. It may be the only contact that a person will make with the health system, and it may be the only opportunity to educate the patient about HIV. In the long run, it will help the counselor to build a rapport with the client. Steps in pre-test counseling. Making the patient comfortable. It is essential to establish a good conduct and contact with the patient. During this process, try to make the patient comfortable. Try to explore the patient's family, occupational, educational, and social background. Second step is reason for testing. It is good to find the reason why that person seeks an HIV test. Many patients who are anxious will try to get the test done. It is also essential to inquire about the practices that may make the person prone to get the infection, that is high risk behavior. Inquires about blood transfusions and for drug abuse. Preliminary inquiries should be made about sexual practices. Sexual practices of person is a very private and personal matter. Unless the patient trusts the counselor, he or she will not reveal it. These inquiries should be made so that risk practices can be identified and the patient can be helped. Third step is concepts and misconceptions. Patient may already have some concepts of HIV/AIDS. Try to explore them. Many times they may be wrong and misleading. And fourth step is clarifications about HIV and AIDS. Tell the patient about HIV and AIDS. It is essential for them to know the differences between being HIV positive and having AIDS. It is helpful to draw a line diagram of the natural history of HIV disease. This gives them the hope that all is not lost and that they have some years of life left which can be used productively. It is necessary also to tell the patient about HIV and what it does to human body. Patients may not know about the immune system. To understand the immune system, simple examples from day-to-day life must be used. The examples could be tailored to meet the occupation of the person. If the patient is a farmer, then the example of protecting the crops can effectively be used. Ask the patient to imagine that she is guarding his/her field. Ask him or her as to what he/she will do if somebody tries to rob the crop or destroy the crop. Then ask the patient as to what will happen if the person becomes progressively blind, deaf and lame, etc. in the process of fighting the enemy. Then tell him/her that similar things occur in the human body. To explain about HIV in body, examples of common symptoms and common diseases can be used. A normal person will experience symptom of fever or loose stools for a few days, 3 to 4 days. An HIV infected person who is asymptomatic will also have the same duration of illness. When the person becomes symptomatic, the duration of the disease will be longer, that is 2 to 3 weeks. If the person develops AIDS, the symptom will last for longer time, 1 to 2 months. Patient will have some knowledge of the symptoms of common disease. Cough, sputum, which contains blood, fever, and weight loss is commonly seen in patients with pulmonary tuberculosis. You can use the patient's knowledge to illustrate tuberculosis in HIV infected patients. Fifth is about health education. Pre-test counseling may be the first and the only time when a person may come in contact with the healthcare system. A physician must not miss this opportunity to educate the patient about the preventive aspects of the disease. Clarify about the test. During the pre-test counseling, it is essential to tell a patient that ELISA test is a test for antibodies that are present in the body. A negative test will not rule out disease. The test has to be repeated after a few weeks. You can explain details about the window period and the need for protecting self and others from getting infected. Practicalities of the test. A person should also be told some practical details of the test, like the cost, location of the laboratory, and the time taken for obtaining the result. You have to find these details from the laboratory where you will send your patients for the test. Coping mechanisms. As the counseling proceeds, you will be able to assess your patient better about the coping capability of the patient with bad news. This can become very valuable at the time of the post-test counseling. It is also necessary to find out from the patient about the people to whom the result can be revealed. Confidentiality. Assure the patient that the test result will be kept confidential and will not be revealed to any other person without his or her expressed consent. If the patient does not want his or her test to be revealed, then it should not be revealed to any unauthorized person. Find out the person to whom she or he wished to reveal the test result. Very often, a close family member or a friend becomes the first choice of the patient. It is always better to motivate the patient to reveal his or her status to someone close to him or her. Consent. Ideally, after this session of counseling, a written consent should be obtained. This often does not occur in practice. A written appointment for the test result should be made. The patient should be made to understand the need for a written visit, even if there are chances that the result can be negative. Post-test counseling. In the case of negative test, when the patient comes for the result, he or she may get a negative result. If the result is negative, then the patient has to be reminded about the window period. If the patient has some high-risk behavior, he or she must be asked to repeat the test after 6 months. He or she must also be told about the ways in which he or she can reduce the risk of acquiring the infection. While talking about the negative test result, it should be explained that the test is for antibodies. A negative test does not rule out the disease. If there is a definite high-risk behavior involved, the test has to be repeated. Post-test counseling in the case of positive test. Breaking the news. Where the test is positive, the news should be broken gently to the patient after adequate counseling. You should be sure and definite about the result. Do not give false hope to the patient by saying that he or she may need another confirmatory test. Give time to react to the news. Many patients will be shocked and will take time to react. They may manifest the various psychological reactions as already mentioned. As a counselor, you need to support the patient through all these reactions. When the person accepts the diagnosis, you have to help him or her to face life. Medical plan. The patient may have medical problems. Try to assist him or her to seek medical help. Not all hospitals will be willing to treat HIV patients. You, as the counselor, will have to identify those hospitals and doctors who are willing to treat HIV patients. Do you know about the facilities available in the area, in your community? The supplementary reading material will help you to identify some of the healthcare institutions in your state or district. Social support. The patient may be worried about the social consequences of being infected. Every problem should be assessed and a solution should be found. Social problems may begin with the family. The patient may be afraid to tell his family. Family members may want to isolate the patient. The patient may shun other family members out of fear of infecting them. Similar fears may be faced in the workplace. As you and the patient explore various possibilities, you will be able to find solution to these problems. Perhaps you may have to organize a meeting with his or her employers, colleagues, or with the family to sort out these problems. The patient may need help to organize his or her financial and legal affairs. Try to find out about various people or organizations that can help in the areas. Plan for the future. The patient may like to make a decision as to how he or she should be cared for at the time of terminal illness. Advanced directives help the patient to make those choices. Reduction of high risk behavior. The patient needs to know the ways in which he or she can reduce high risk behavior. Patient will be more receptive to avoiding those behaviors if patient knows that he or she is positive. If the patient is a drug addict, try to find facilities that will help him or her to give up drug addiction. If that is not possible, try to get clean needles and syringes for their use. Needle exchange programs. If the person has multiple sex partners as a risk factor, then try to advise him or her against that practice. Patients also needs to be told about the protective effects of condoms. Patients also have to be told about the correct use of condoms. Networking. In the area, there may be groups of HIV infected people. They may be helped to organize themselves into a support group. Try to help the patient to become the part of the group. It helps the patient to know that many like him or her have the disease and they can support one another. Patients who suffer from HIV infection often seek spiritual solace. Try to identify various spiritual organizations in the area and try to make these organizations help your patients. Support the patient. Assure the patient that you will always be there to help at the hours of his or her need. This calls for total commitment from your part. You may have to give him or her contact address so that the patient can contact you at the time of need. Can you do all these things in a single session? Obviously, it is not possible to do so in a single session. Post-test counseling is a process that involves many sessions. Crisis counseling. Patient may have acute problems that may threaten their social well-being. The parents may force the patient to marry. He or she need counseling to face such situations. Can you suggest solution to this problem? There are different ways of tackling this problem. He or she can inform the parents about his or her HIV positive status and its consequences. The patient may say that the patient is suffering from a serious disease and would like to avoid marriage. He or she may talk to his or her fiancé and tell him or her about the disease and marry if the other person is willing. The patient may find an HIV positive patient and marry that person. These are some of the options that are available and being practiced. All these possible options need to be discussed. The patient should decide the best option for himself or herself. After the best option is selected, a plan should be made to implement it. The patient decides to tell the parents about the disease, then it should be informed to the doctors to say the same. All these details have to be worked out. The patient should report back to the counselor and tell about the progress that he or she is making. This type of counseling is called crisis counseling. Adherence counseling. Today there is treatment available for HIV infected person. This treatment is known as highly active antiretroviral therapy, HAART. Combinations of 3 different drugs are used. These drugs may be given as individual drug or may be formulated into a single tablet. The drugs suppress the virus, improve the quality and prolong the life of HIV infected patients. These drugs have to be started at an opportune time and have to be taken lifelong. If these drugs are taken irregularly, the virus will become drug resistant and the disease will progress faster. Resistant strains will be seen in the community. While for other chronic disease, 80% adherence may prevent the progression of the disease. HIV requires more than 95% adherence. Even missing a single dose in a month can be deleterious to the patient. Hence, adherence is very important. Adherence involves change in behavior so that the patient is disciplined and conditioned to take medicines. Adherence counseling should start from the time of the diagnosis of HIV is made. Patients should be told about the availability of HAART, the cost of treatment, and that it will be started at an appropriate time. The Government of India has set up free antiretroviral treatment ART centers. Find a center in the area. Patient taking HAART must always be monitored by a physician to see the effects of the drugs. Hence, constant and regular attendance of medical center is needed. All these aspects have to be stressed during the post-test counseling. Once the patient has been started on treatment, check about the drug intake during every counseling session. Inquire about the side effects. Find out of the patient if the patient has any difficulties in procuring the drug supply. Encourage the patient to continue the drug therapy. If patients have missed their drugs, ask about the reasons for missing the drugs. Very often, patients may forget to take the drug. Help them to overcome this difficulty by using pill organizer, reminders, or by using other family members to remind them to take the medication. Every encounter with the patient talks about adherence. Group to be tested. Who are the people who need to be tested for HIV? High risk behavior. People who have history of high risk behavior need to be checked. People may have multiple sex partners. Under this category, sex workers and their customers can be included. Men who are away from their families for a long period of time, like truck drivers, migrant laborers, traveling salesmen, and security personnel, etc., are likely to indulge in sex with unknown person or with different partners and are at risk of contracting the disease. Men who have sex with other men are likely to get the infection, and they need to be checked for the infection. Spouse of HIV infected patients are innocent victims of the disease. They also should be offered the test. National AIDS Control Organization guidelines for AIDS should be followed. Some medical conditions may make the doctor think of HIV infection, and HIV test will be sought for by the doctor. People who have received untested blood or blood products are at risks of acquiring the infection. Similarly, organ recipients are at a high risk if the organ have not been tested before being transplanted. Consent. All testing that is done should be voluntary and with informed consent. Informed consent means that the patient will have to undergo a pre-test counseling. No test should be done without a pre-test counseling. In practice, very often it is not done. This leads to lots of difficulties for the patient as well as healthcare workers who subsequently have to deal with the patient. All clinical testing should be voluntary. The advantages of voluntary testing are many. Advantages of pre-test counseling. If the patient gives uninformed consent, then we can expect that he or she is prepared to face the test result. He or she will trust you since he or she gives the consent. He or she has control over his or her affairs. He or she will be more receptive to change the behavior. Hence, the spread of infection can be reduced to a greater extent.